Hi, I'm Dr. Charlene Cook. Today we're here at Central Georgia Equine Services. We have got a 2-year-old Tennessee walking horse stallion who is in for castration today. And we thought that we would give you a chance to go through this procedure with us. And today I'm going to wear a GoPro camera so that you can actually see what I get to see and take you along with us on our day. Okay, so to start our procedure, the first thing I want to do is do a physical exam. I want to make sure that the heart and lungs are healthy enough for anesthesia. Without that, the surgery is a moot point. And so I'm going to start by listening to the colt's heart and lungs. Okay, he's got a nice regular heart rate and rhythm, no sign of any murmurs, no arrhythmias, and his lungs are clear. If he had pneumonia, that could actually make his pneumonia worse because we're actually going to lay him down. The next thing I'm going to do is get his temperature, and I'm going to make sure that he has both testicles so that we can do our procedure. As you can see, this colt's an ideal weight. He's a good surgical candidate in terms of his overall general health. Sometimes we'll see a colt that is too debilitated, and we'll ask the owner to get them into better condition before we do that procedure. Other things that we've done to prepare this colt, we've had him off feed now for 12 hours. They can have hay and water. They'll have water up to surgery. They can have hay up until about midnight, but we did not feed this colt any grain this morning in order to be ready, and we do that to reduce our incidence of colic. His temperature is normal, and we'll get a weight so that we can calculate our anesthetic dosage. Okay, this guy's kind of a string bean. He weighs in it right at 800 pounds. And you can clearly see that both testicles are present. He doesn't have any excess fluid. The testicles are oriented normally, and his scrotum and sheath otherwise appear to be normal. Last thing I want to check is what his mucous membranes look like. This colt's a little nippy, so we'll be a little careful. But he's nice and pink. And so now we're ready to go ahead and administer his pre-med. So I've drawn up my dosage of acepromazine, which I'm going to use as a pre-medication. It will relax the colt. It helps with smooth muscle relaxation, so these guys go down a little bit softer. So we're just going to give this IV. And then I normally like for the colt to have about 10 minutes to fully relax. It seems to make a big difference if we let them get a little bit quiet before we actually go to induce them. Keep in mind when you're looking at this, there are lots and lots of ways. Different doctors have different protocols, different procedures, different routines that they like. The routine that I'm using just happens to be one that I particularly like.
Hi, my name is Elena Ricks with Central Georgia Equine Services. This horse also uses bandages on his legs because he has a bandage shoe and hardware on, and we're also going to put some fly spray on before he goes out for this procedure.
Alright, so it's been about 10 minutes and our colt's relaxing nicely. I've chosen this paddock today to geld this colt in. As you can see, it's nice and grassy, it's relatively level, and it's free of objects by and large that a horse might get caught into. I try to avoid situations particularly with barbed wire, wire fences, bodies of water, whether they're swimming pools, ponds, etc. They tend to be trouble. Other things that that a horse can get hurt on: farm implements, fire ant nests, wood, lumber, anything that's got nails in it. We try to avoid.
Hi, I'm Dr. Catherine Hull. I'm also work here at Central Georgia Equine Services, and I'll be doing anesthesia on the colt today. We've given him the acepromazine.
And then we also, as another pre-med, give him some xylazine or rompum just to take the edge off, help to go ahead and relax him. And then we'll give him ketamine as the final drug to actually lay him down. So, here it goes.
Okay, so we're almost ready. Dr. Hall's giving her first dose of sedation to really get him relaxed, and you'll notice that we're using a nylon webbed halter. A leather halter would also be appropriate. I really try to avoid string halters. They can put too much pressure on the horse, and the use of the nylon halter is going to be easier on us to help lay this colt down. Over on the side we have all of our equipment ready. We've got our pads, our surgical instruments, and some extra medications should we need it. So I think we're ready. So Dr. Hall's given the ketamine. From this point forward, we're going to keep our voices very quiet. In about a minute or so, this colt should go ahead and lay down. We're going to try and help him down the best we can so that he doesn't injure himself in the process. We're going to cover our colt's head. It helps reduce stimulation. He's going to sleep a lot quieter for us. Okay, and Elena's going to stay with him. You might want to leave that one on. Dr. Hall's fixing a restraint rope on this leg. I prefer to have someone hold the leg for me. I feel like I'm in less risk of injury that way. Okay, to prep the skin, I'm going to use an antiseptic solution on some cotton. This colt had a bath yesterday, so he's pretty clean. This type of surgery is referred to as clean surgery, but not necessarily sterile surgery. And since we're not entering a body cavity, that's okay. My instruments have all been prepared and they're soaking there. Thank you. Before I make my incisions, I'm going to put a little bit of lidocaine in each testicle. I'm going to put some in the spermatic cord itself. And then I'm going to put a little along my incision line. This reduces pain for the colt while he's actually having his procedure. Okay, I'm now ready to begin my surgical procedure itself. I'm going to grasp the testicle, and I've predetermined my location on my incision. I'm going to go right across the middle. I'm going to make this incision very long. The longer I make it, the better drainage I'll have. I'm going to go right through that subcutaneous tissues and expose the testicle. And I'm just removing this tough fascia from the testicle and the cord. Now, this is part of where I actually had gone into the testicle with the lidocaine. I'm going to open the tunic, which allows the testicle to pop out, take some tension off the cord. And then I'm going to use my emasculators to slide down the cord, getting them placed as close as I can.